Alex Haggerty. I'll start over. Alex Haggerty. Sorry, that one wasn't going right. I'm so sorry. This has been giving me a little bit of trouble, the recording device that Mary relies on. So I'll start over. Time being about 7:01 now. March 4th, members present, Alex Haggerty, Chris Schultz, Terry Mays, Linda Dickey, and myself, Susan Emery. Our health agent, Marty Golightly, is excused. First, we have the Pledge of Allegiance. Everybody would like to stand?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Alrighty, as we're sitting down, I'd like to say thank you to Mary for putting our meeting on the calendar on the front of the page. The first item on the agenda, or the second item on the agenda, is the substance awareness update that Alex gives us. Alex, would you care to give us an
Sure,
update?
absolutely. So for my substance awareness update this week, I want to report on the measures that are being made to tackle opioids and substance addiction here in Massachusetts. Also, not more importantly, but on another topic, also report on the Brook Recovery Center, which actually opened today. So, with that being said, I will do my little update. So, as of today, the recovery. Hold on, excuse me. Excuse me. Let me start off again.
Take a deep breath.
Yeah. As I have stated before, recovery is a huge factor in winning the fight against addiction. I am proud to announce today that the Brook Recovery Center, a licensed day outpatient treatment center, mixing clinical and medical my gosh, I can't even speak today.
That's okay.
Modalities, with the life-changing 12-step spirituality, has opened its doors today. The Brook Recovery Center is an addiction treatment center serving adult men and women suffering from substance use disorder and other co-occurring mental health disorders. The center provides psychiatric services, expert clinical services, and intensive addiction treatment from 30 to 90 days. The Brook Recovery Center in Abington, it will be a tremendous asset to our citizens and to the public health. The citizens of Abington need to have this institution like this present as an outlet to seek positive help and encourage to a path of recovery into a better life and healthier life. I will continue to be in touch with the Recovery Center on a monthly basis or whatever have you. I spoke to them today. They actually had a great opening, a lot of feedback, and a lot of good feedback. So a lot of good things in the work with the Brook Recovery Center. So it's going to be very exciting. So if anybody wants any more information on the Brook Recovery Center, residents can check out their website at www.brookrecovery.com. Also their Facebook page, also under the same name, Brook Recovery Center, or their office number at 1-833-782-7665. The Brook Recovery Center is located at 673 Bedford Street, Abington. All right. Now, on a different measure, talking about Massachusetts, it was reported on Tuesday, February 26th, last week, that the Massachusetts State Legislature of the Harm Reduction Commission had recommended the approval of one or more safe consumption sites. These safe consumption sites will be designed to be pilot sites where people can consume illegal drugs in hygienic surroundings with trained health career staff on site who can revive those who overdose. This proposal has been submitted and approved by both the Harm Reduction Commission and the Secretary of Health and Human Services, Mary Lou Sutters. However, Massachusetts Governor Charlie Baker does not support this measure of safe consumption sites, or as it's also called, as safe injection sites, as they're also referred to. When asked about this proposal, Governor Baker, who has been a strong advocate for prevention, the end to addiction, and helping people into recovery, has stated that the proposed process is illegal under federal law, and helping people into recovery under federal law, and he wants to focus on legal actions that we can take to curb the overdoses deaths. As of today, safe consumption sites are illegal throughout the United States, and thus none are in the country. So now I'm going to give my opinion as to this.
Okay.
I know this is part of the report. As I have stated before to the Board of Health and to the town of Abington, I want to be a strong advocate for prevention, treatment, and recovery in the fight against addiction. I believe it is our duty to not encourage these deadly poisons and to not encourage individuals to go to places where they can do harm to themselves. We must be persistent to educating the people of our communities on the dangers of illegal drugs and substances. As a Board of Health member, I do not support this legislative proposal to open safe consumption sites here in Massachusetts. I believe this measure would be a step in the wrong direction to fighting addiction. Fighting addiction is not an easy climb, but with education, prevention, treatment, recovery, and working together, we can beat addiction. So I do encourage everyone, not just in Abington alone, but reach out to your state legislatures and encourage them to not support this bill, this piece of legislation. It's extremely dangerous. Not only is it extremely dangerous, but it's illegal in the United States. But to finish, the next Abington Substance Awareness Coalition meeting will be held on Wednesday, March 13th, 2019, at 7 o'clock here, down on the bottom floor of the Abington Town Hall. As I always say, the meetings are open to the public and all are welcome to attend. So with that being said, this has been my substance awareness update.
Excellent. Does anybody have any questions for Alex?
Nope.
Anybody in the audience have any questions for Alex? Excellent. Excuse me. All right. Moving on, and I might have a different agenda than you guys, and if I do, then please speak up. So the next item on the agenda is I have the rabies clinic.
Oh, we have it's the plastic bag ban.
Okay, the plastic bag. Chris asked for this to be on again, and so I see Marty's given us something from the South Shore Recycling Co-op that we are a member of. Discussion?
I actually spoke to the health officer in Pembroke this week to see how their ban had gone.
Lisa?
Because they just recently banned plastic bags.
Was that Lisa?
Whoever answered the phone.
Oh, okay.
I believe she was the health agent. And they used Marshfield's ban, and they said at first when they brought it up in town, they did have a small group of vocal people that were totally against it, but when I guess theirs went to town meeting and they voted and it was unanimous, and they just went ahead. They said most towns, it's unanimous, people are all for it. And now we have probably over 102 communities that have banned them. We only have 362, so it's getting more and more.
It'll be statewide.
Yeah,
soon.
and we should probably keep this on the agenda until we decide what we're gonna,
I don't see a problem
you know,
with that,
do.
sure.
No, I don't see a problem with that.
No. And any board member can
discussing.
put anything on the agenda that they want to at a time. Nobody has to wait for me, so don't feel like you have to
I
wait
just
for me.
figured we should be talking about it, you know?
Yes.
Where Boston just did it, I think eventually, actually it is on I believe it's on the thing for the state to vote to ban them.
It might be.
I think it is, but I'm not positive.
It might. I know my
I think
focus
this
is
will be the
always in
first
another
time
direction. So
Going
yeah,
that way,
yeah.
we'll
So.
see.
So anybody from the audience have any opinions on potential? Possibly we're considering banning plastic bags in Abington. So.
I think one thing to, if we're gonna do the plastic bag ban, one good thing to look into was, because I know there's a lot of word in town that people want to keep the plastic bags, but if we're moving in that direction, there are alternatives so we could ban the plastic bags, but also give the convenience of still using something like a plastic bags, but because I know Boston uses this, there's something called like Eco Hippo or whatever like that, so It's plastic bags that are 100% recyclable. I don't know if that's something we could look into. I mean, I know the Abington Ale House, I asked them about this because they use these bags, so they're not plastic bags, they're the eco-friendly bags.
Okay.
So I was just wondering if we could look into that. So
Absolutely.
if we
Yeah,
eventually...
these things aren't done in a day.
Oh, no,
Yeah.
no, I'm just saying...
Well, I think we should definitely assist the businesses in switching over if there's any way we can. I know that's what a lot of communities have done. Like I said before, those 2 watersheds that I talked about last time that are encouraging, they're actually giving away the reusable bags. And I mean, I use mine. You can use them for years before, you know, as long as you wipe them out. You can even throw them
Yeah.
in the washing machine and then dry them. Because I do that with plastic capes that I use at the hair salon.
Yeah,
And, you know, it's not gonna ruin them.
no.
I did do some research today myself, and the United States is actually one of the world's top 5 waste-generating developed countries, according to World Economic Forum. And there's about 8 million tons of plastic garbage in our oceans. They're estimating experts predict by 2050 there will be more plastic in our oceans than fish. So they say a garbage truck a minute is emptied into our ocean. I know plastic bags, it's just the beginning really. A lot of towns have actually banned the small water bottles too.
Yeah,
Because, I
I
mean,
think,
people
yeah,
are
I
actually
think those,
building
yeah.
islands with those.
yeah. I think people want to ban straws too.
Yeah. And there are alternatives,
Yeah.
even with the straws and plasticware. There's a company in Mexico that's using the seeds from avocados to make straws and plasticware,
Yeah,
and it's totally biodegradable. So
Yes.
there are lots of options. I know that plastic can be easier and cheaper to be made, and it's convenient.
yeah,
And there's pros and cons of both,
yes.
but
And I think Chris brought up something about repurposing. I don't know if it was maybe an article that you might have posted or a real conversation that we had, but I remember you saying something about repurposing some of these things and making them into something that you could maybe give another life to by making it into a brick or...
Eco bricks, yeah.
Yes, I knew I had to use the right term to create a connection between the two of us on that conversation, or however it was, that information sharing that we had. But yeah, I think it would be great for us to immediately start on thinking of that sort of thing, and possibly devising a path for our businesses.
Yeah,
Otherwise, as everybody has suggested.
well, the lady in Pembroke that I spoke to said that most of the businesses, when they heard that they were thinking about it, they actually switched over without even being told.
A lot of
Before
our
it even-
businesses did that
yeah,
with
they
the
did with the
styrofoam
styrofoam
too.
also.
Absolutely.
So they were all for it, and they said they really haven't seen a big
Right.
issue. People
But I
in
think,
town
yeah,
don't have a problem.
I actually think the more time we can give them to
Yeah.
find solutions for themselves, the better.
Yep.
And all of this is information sharing that I think is good and worthy.
Yeah, absolutely. No, because I was just, my only concern was just letting the businesses, not leaving them high and dry, like, okay, we're getting rid of the plastic bags, here we go, you know, and
No.
not,
Yeah,
with
things don't
nothing.
happen
No.
that quickly.
Even with the styrofoam, look how long it took.
It took,
2 or 3
it
years.
literally took 2 years.
Yeah, it didn't, if I'm not mistaken, didn't letters go out to the businesses
Yes,
before, so.
right at the beginning when we first started talking about it, we actually
was
sent out a
2
poll
calendar
for
years.
them to answer
Absolutely.
questions and see how they felt about it.
Mhm.
Yeah. And I think what we figured,
We
10%
didn't get a
of
lot-
them.
We didn't
Yeah.
get a lot of.
We didn't get a
No.
lot back.
No.
Yeah, there was
And the
like, I think
ones
there was
that-
like 10%
yeah.
that responded.
And the ones that did come in front of us that were upset about it admitted that they didn't look through their paperwork. It was lost. So,
Yeah, and some of that too might be why, when they get their renewal forms. I mean, they
Yeah.
get it right at Christmas time, the renewals end at the end of the year. You know, anything you get between Halloween and Christmas, you know. But that's just a fact of life. So does anybody have anything else about the plastic? Then I guess we're gonna move on to the rabies clinic. I wanted to, and I probably will, if you don't mind, mention the rabies clinic, which is May 11th, is it?
I did bring it.
I know you're doing it. Linda, thank you very much in
Linda.
advance for working the rabies clinic. I don't think that we'll be able to have the town clerk there this.
No, I don't think, and you know
Yeah.
what, she wasn't there last year, but
Yes.
every year before that, she was there.
She has been,
I can't
yes.
find the paper that I had that written on.
That's all right. I believe it's the Saturday in May, that's the same Saturday of Mother's Day weekend.
Yes, it is.
It's probably the 11th or the 13th, and,
Yeah.
you know, so that's whatever is the Saturday there. So the next on the agenda is, and while I am doing my thing, do you guys mind if I pass down the minutes? Because I think that you all can look at the minutes, or probably have, so that when we get down to talking about the minutes, we'll be able to give an immediate vote on that, because that's our last thing on the agenda. So the next thing on the agenda is the Health and Medical Coordination Coalition. That's the HMCC, and what they do. And the last item is deliverables, and that's kind of all in one thing for me. So that's why I figured I'd pass that down. What I did was, because this was kind of a big subject for me, was I did print up what I was going to say. There are a couple of papers here. I think I'll just pass them to you guys through the audience to look at. Do you mind? I don't think that we have extra copies, but if I find that we do, then we can. Oh, thanks. I appreciate that a lot. So what I did was, I actually do have, so what I did was I wrote up notes, because it was a couple of hours for the thing. So I wrote up what I wanted to say so that I would be clear and coherent. So this was March 1st. It was the stakeholders meeting. That's anybody who's involved in our division, which is, Region 5. And we're in Region 5 of the HMCC, which is the Health and Medical Coordinating Coalition. And we're also in Division 5 for the SHARE MRC. And SHARE is Stoughton, Holbrook, Avon, Abington, Randolph, and Rockland. So I think you can see why I sometimes get the two mixed up, because they're very close to each other. I wanted to attend this meeting because there has been a lot of personnel changes, and I wanted our town to reestablish ourselves in these matters. But I also learned some new to me things that I wanted to share with you guys. So in this meeting were the actual folks that man the phones 24 hours a day, 7 days a week, 365 days a year. They are called duty officers. Actually, one of them's named Terry Mays.
No, there isn't.
Yes, there is.
M-A-Z-E?
Oh, I don't know how he spells it, but he's a man. So I met him once before, but it was so easy for me to remember his name because of your name. They are called duty officers, and they were actually in the room. So I thought this was great, good stuff to be in the same room with them and be able to talk to them and find out what they need from us if we have to call them. Some of the personnel we have dealt with in other departments and in other ways, and that was actually encouraging to see too, that because there just has been so many personnel changes. Also in the room was Sean Murray. Now Sean Murray would be like the new Jean Benacasa, and I think Sean Murray. Now, Alex, did you do an EDS walkthrough recently? With Marty?
No, actually, we had to reschedule that one.
Oh, okay.
Yes.
So, but I think, Linda, you and I have done EDS walkthroughs before
At the high
this
school.
new, well, I think we've done it at the old high school. We would do it at the new high school now. But the EDS walkthroughs, that's, so if there's an emergency, like we had a year ago today, and we had to use the high school as an emergency shelter or emergency dispensary site, which is what EDS stands for. They do a walkthrough, and they go through and they say, oh God, this room would be great if we had people that we needed to isolate because we thought that they might have an infectious disease. And we're just giving out water, so we don't want to, pass pneumonia through the line. What would you do, what if, and all of that stuff. So Sean Murray is our new EDS person, so he was in the room. And he's the person that would do the EDS walkthrough now. So it was nice to get to meet him. And
So Jean's gone.
yeah. This is exactly my point, though. I was glad I went because as we went through the room like you do on these things and people were introducing themselves, I did see a lot of new faces for this. We used to have Lisa Cullity, I believe is her last name. She's the Pembroke health agent. Now she's the new head of our share MRC. She wasn't there, but I met her at something like this. But it's good to now be able to put a face with a name. If we ever did have to work together in these things, at that moment, it's invaluable. So I did see some folks that we've dealt with before that have moved around. Even a lot of the offices are changing. They're changing from Middleborough office down to New Bedford. The HMCC is an entity that we would use in an emergency. They're a bit like a procurement agency. So if we had an occasion where we needed 5 million tops, they would get them for us. And there are places within the Commonwealth that these things are housed. And it was fun listening to them. I guess there's a prison down in Barnstable that they use, and they have stockpiles of water and anything that we might need, so that if the emergency were to happen, that's our stockpile and that's where it is, and it's there because they have a generator that's this big and it's this dark and it's this secure. And it was just very interesting to see all of that. It made me feel a little bit good about how we as a Commonwealth are prepared and how we as the local Board of Health fits into that. Let's see, Region 5 is determined by counties. Region 5 is Barnstable County, Dukes, Nantucket, Plymouth County, and Bristol County. It's also Avon, Foxborough, Holbrook, Plainville, Randolph, and Stoughton. Now those are parts of other counties, but they're in our Region 5. And they kind of bind us all together because Avon has a lot of businesses, but not a lot of residents. And that's why we get paired up with them, because they have a lot of resources that we don't, and we have a lot of personnel that they don't. It's part of the grand design. I didn't obviously have anything to do with that. The Massachusetts Association of Board of Health support the MCC administratively. So if there ever is an emergency, we as people would support them and tell them what we would need, but they would get us the things that we need. They wouldn't come down and direct traffic, anything like that. The HMCC is funded by the CDC and ASPRA, which is the Assistant Secretary for Preparedness and Response. And we talked about ASPRA last week. And ASPRA mostly does a lot of trainings with those webinars. And also in the packet, because this is an ASPRA event, was another, these are the ASPRA planning, and these are webinars that they give for emergency preparing. This is a series of 4 of them. But I think that the strong advantage of these is, number one, they're free. And number two, they you can do them at your own home. These ones are locked into certain hours. And I'd just like to pass along that information.
Susan,
Yes.
do they ever do any of these on the weekend? Because like these times,
And Wednesday in the
work.
middle of the day.
yeah, I mean,
It is, yeah. I don't make them up. I wonder if they ever would allow this to be on a YouTube or something, because I noticed they do that afterwards.
Well, this one is continuing education for professionals, that's why it's a weekday.
Oh,
because it's in their workspace.
Yeah.
Yeah.
So that's, okay.
When
That's
I
what
do
was
these,
Looking down here at the accreditation, I'm like, wait a minute, these people actually work in
Yeah.
these environments, so
Right.
that's why they can do it between 11 and 12.
I think this is
today.
something Marty has to do,
Yeah.
whereas, you know.
Yep.
I do them too because of the MRC and the share, and it just helps me at that juncture, because I'm getting good at those. now, which is good. But they're just an hour, so it's easy for me to get bang in and bang out. And I just like to let people know about them. They had a couple other things here too, so if I could just get back, just because I don't want to lose too much. The other things that we talked about is different things that our chief of police is going to do, hazardous mitigation plans. I was very interested to hear where things are stored and why they are stored. I was also got to meet a new MRC contact person. Her name is Lisa Jackson, and she's agreed to work with us in gaining some volunteers for our emergency prep. I guess the biggest takeaway for me was how can we convince our citizens to become involved with our emergency prep before something happens, and the reason why we need to have people enlist and agree to help before an emergency happens is because we do need them to be quarried or sorried or have a little bit of training. So that's the challenge. The subject of deliverables, and this is the last, the deliverables was a part of this stakeholders meeting. So the subject of deliverables was discussed. I know, for example, that, and we know that we received deliverables for having the compost site open a certain amount of weeks out of the year, and we enjoy that. We get that through a different agency, but how we would actually achieve deliverables for any particular training and how many people would have to attend for us to receive those was discussed afterwards. So I didn't get to be involved in that discussion. So that one, you have to write the agenda up on Thursday, and the meeting happened on Friday. So I couldn't possibly know what was gonna be on there. It was easier for me to put it on and explain why. Does anybody have any questions about the HMCC or?
Well, I know we've talked about getting volunteers in town. We have over 400 residents, I believe, that are either in the medical or.
I think it's 6.
Is it over 6 now?
Mm.
Well, they keep building, we keep getting more residents.
Yeah.
So, yeah, I believe it.
Yeah.
So.
Yeah, this Lisa Jackson seems to think, and I just sent her an email today, like everybody else, it snowed for me today too. So I was, had a bit of a different day that I had planned, but she said that she might have some devices or mechanisms to help us do that. I'm crossing my fingers. These other two things these were also flyers that were passed around. They didn't have these for people to take with them. So I took a picture of them with my phone and sent it to Mary so she could print out. Just the safety toolkit for local public health officials is a registration that would be just for public health inspectors and such. But it was just interesting to see the presenters and see how they interact with our people. And this ounce of prevention is something, I'm not going to go to anything on April 2nd, but I just thought I'd let you guys know about it.
And another incentive for volunteers, like Jean Benacosta told us when she was doing this, is that if you do volunteer and there's a need for something, your family gets to get that first.
Right.
So it's kind of an incentive to volunteer.
Yep. Yep. Yes. And so, do you guys have anything else about that? I'm sorry I wrote it up like that. I just thought it was a lot of information.
No, it's all right.
So what, are we
It's
on
good
the
to know.
minutes now?
We are on the minutes.
I'll make a motion to accept the minutes from.
I'll second it.
All those in favor
February
say
19th.
aye.
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 So that's all in agreement? No, anybody say no? No, nobody says no?
Motion to adjourn?
Second.
Does anyone from any public comment or anything?
There's a motion to adjourn?
Has anybody seconded?
I second.
The only reason I asked is it wasn't seconded, that's why.
Yeah, that's
That's why.
fine. I
No need to get
believe that
snappy.
if the audience doesn't have anything that they care to add, and we have a motion and a second to adjourn, then I'd say this meeting is over. That's it. Perfect. So, how'd you guys like your meeting?
Is that exciting, Arthur?
Thank you. I appreciate it.
Short and sweet. That's,
Is trash day tomorrow?
Yes.
Yes.
So you get that?
1 day delay.
Oh,
If your trash is tomorrow, then it's the next day. My trash is Tuesdays also, so it'll be Wednesday. Yep.
Just wanted to stop the camera.
Thank you.
You're welcome.
It's the only reason I even put on makeup today. It's Monday. it's my day off.
You know what, I did, I said, there's no way I'm putting on fancy shoes. All right, so that's that, those all go in there, I'll bring those down, because I get the key to lock up the office.
Oh,
All right, everybody, safe journey home.
yes, it's gonna get really